Okay, I'm ready.
Alright, scenario. Upon arrival, you find a 7-year-old boy sitting on a bench and leaning forward in the tripod position. As you approach him, you hear audible expiratory wheezes. Dispatch info is you are called to an elementary school playground for a 7-year-old child having difficulty breathing.
Okay. I would don my PPE, gloves, possibly a mask since it's respiratory. I'm assuming my scene is safe.
Yes.
Okay. Nature of illness is difficulty breathing. It's a respiratory issue. One patient.
Yep.
Okay, I'm not concerned about C-spine at this point. Because of the age of the patient and respiratory distress, I'm going to go ahead and request ALS be en route. General impression of the patient appears to be a 7-year-old boy sitting on a bench with respiratory distress. Excuse me, buddy, are you all right? Does he respond? Is he responsive?
He is responsive but anxious.
Anxious, okay. And what seems to be the problem? You all right, buddy? What's the chief complaint?
Chief complaint is difficulty breathing.
Okay. All right, I'm going to go ahead and check his airway. Can you open your mouth for me? All right, it says airway clear?
Yes.
All right.
Currently open, audible, expiratory wheezing heard.
Okay. I'm going to give a quick listen to his chest.
Listening to the chest, you hear wheezes in the upper lobes, little air movement in the lower lobes.
Okay. Little air movement in the lower lobes. Okay. I'm going to get a SpO2 sensor on him, pulse ox, and get his SpO2 reading.
87%.
Okay. I'm going to go ahead and start him on a non-rebreather at 15 liters. I'm going to check his circulation. I'm checking his pulse. Pulse is present.
Radial pulse is fast, strong, and equal.
Okay. What's his skin condition?
Pale, cool, and moist.
Okay. Okay. I'm going to go ahead and say that he should be a priority transport, and we're going to work on getting him transported quickly. Hopefully ALS is on the way. I'm going to go on to my sample history. What was the onset of the symptoms?
Where is this at? Approximately 15 minutes prior to arrival.
Okay. What seemed to bring it on, make it worse, or is there anything that makes it better?
It just says running on the playground with classmates.
Okay. All right. What's the quality of it? Given that it's respiratory distress, I guess the quality is just difficulty breathing.
It is shallow respirations, but no pain.
Okay. His no pain, so radiating pain is not an issue. The severity of it?
Severe respiratory distress.
Okay, and the time, approximately 15 minutes ago?
Yes.
Okay. Signs and symptoms, he's got low SpO2, he's got difficulty breathing, he's pale, and appears to be in respiratory distress.
You also notice nasal flaring and use of accessory muscles for signs and symptoms.
Okay. Is he allergic to any medications?
Amoxicillin.
Okay. Is he on any other medications?
Preventil inhaler, which is in his backpack in the classroom.
Okay. I'm going to ask school worker to accompany my partner to go get his inhaler. What is his past medical history?
Only asthma.
Okay. Last intake?
Lunch.
Okay. And events leading up to it, you said playing on the playground with friends?
Yes.
Okay. I'm going to go ahead and, again, just assess his breathing and see how his, you said I noticed nasal flaring and accessory muscle use, correct?
Correct.
Okay. I've got his breath sounds. I'm going to go ahead and take vitals. So I get his blood pressure.
96/62.
96/62. Okay, young patient. His pulse rate.
152.
152. Okay, what's his respiratory rate?
48 breaths per minute.
48. Okay. All right. I'm gonna assess for. Okay. Nope. My general impression or my field impression of the patient is that he's got that he's having an acute asthma attack. My partner returns with the inhaler. I contact medical direction to get authorization to assist the patient in using it. Since he's anxious, I'm going to make sure that I'm very clear that he needs to breathe when I am pressing and that he needs to hold his breath for as long as he comfortably can. Usually an inhaler is 2 doses. I will confirm that with medical direction. If ALS is here, they may put him on a nebulizer, depending on local protocols. And I've got him on oxygen when I'm not giving him his inhaler.
How would you do the oxygen? How did you say you'd administer it?
Non-rebreather at 15 liters per minute.
Okay, thank you.
Okay. When I'm going to reassess the patient every 5 minutes, so I'll go ahead and since I've given him his inhaler, I'll go ahead and check his SpO2 again.
So, checking SpO2 again after giving the inhaler, you're at 92% on 100% oxygen.
Okay. I'm checking his pulse again.
139.
Okay. And his respiratory rate?
42.
Okay. And I'm going to check his lung sounds again as well.
Wheezes, upper lobes, increased wheezes in the lower lobes.
Okay, so we've got improvement in the lower lobes since there was no breath sounds present before. All right. We would be on the way to the hospital if ALS has not arrived yet. Regardless, I would give the report to either ALS or the ER. Patient was in respiratory distress. His SpO2 was at 88% on room air. His heart rate was 148 prior to administration of albuterol. His his blood pressure was, I forget the first set of blood pressure vitals.
The very first set was 96/62.
Okay. After the administration of albuterol, his SpO2 was at 92 on 15 liters per minute via non-rebreather. His lung sounds initially, he had wheezing in the upper lobes and absent breath sounds in the lower lobes. After the administration of his inhaler, there are now some wheezing sounds in his lower lobes, indicating that he's got some airflow down there. His respiratory rate after administration of his inhaler was, what was it, 28?
After administration was 42.
42, okay. His oxygenation improved, and his how's his mental status, his anxiety? Does it say anything about that after the administration of the inhaler?
Let me see. It does not say.
Okay. All right. I think that I am done.
Okay. Are you done recording?
I'm not.